Welcome to everyone who has chosen to attend Chronic Health Condition Considerations during school reopening. We want to set the stage by asking you to consider the following scenarios. You have an elementary student newly diagnosed with asthma over the summer. This requires nursing assessment to identify and confirm the severity of the disease. It requires the healthcare provider orders to be interpreted. The family situation and how it impacts the health of this student needs to be explored. And ultimately, the decision needs to be made about whether or not case management is needed. Will you be prepared to address this student's health and academic needs? Or what about the high school student self-managing type 1 diabetes? That's the diabetes that requires insulin. While they may not require intensive health services at school, they will still need an emergency care plan in place for potential hypo or hyperglycemia. And there are other considerations just because of the age of the student. They could be higher risk of being an asymptomatic carrier, or they may be engaged in high-risk behaviors for COVID transmission, typical of a teenager placing the student and others at risk of spread. Do you know where on the continuum of chronic health conditions your students fall? Medically fragile to self-managing. For example, what about the medically fragile middle school student who is sensitive to smell, touch, or pressure, so they may not tolerate facial coverings? This student typically receives nebulizer treatments at school. Should they continue? Should this student be back in school at all? And what about your school staff who may have a high BMI, type 2 diabetes, or be a transplant recipient? Will you be prepared to address your school staff? These scenarios create pause to consider what needs to be in place to support the health and academic success of these students and staff in the midst of COVID-19 and schools reopening for in-person learning. With those scenarios in mind, consider this. The CDC guidance lays out how to layer measures, strategies, recommendations to control the infectious disease COVID as schools reopen. But what considerations are needed when you layer students and school staff that have a chronic health condition with COVID-19? And what do you need to consider when you layer existing and emerging vulnerabilities in your students and school community, such as social issues, being newly unemployed, loss of insurance coverage, grieving the loss of a loved one, family structures such as grandparents or great-grandparents as head of household, with students moving between home and school? What about the mental health issues, anxieties about returning to school, and community, social, and environmental factors, or the social determinants of health, such as access to care or burden of disease? When you take these variabilities into consideration, what is the level of risk for students to achieve the positive health and academic outcomes you want for these students? With these considerations, do the priorities of school health services need to change? Does surveillance, meaning identifying which students have a chronic health condition, become more of a priority? What about the need to promote general health and wellness, immunization compliance, vision, hearing, and dental screenings? Does identifying the insurance coverage status take on new meaning? These are indeed layers of considerations for schools reopening for in-person learning and students with chronic health conditions. So let's pause for you to identify your top 2 concerns when you think about students or staff with a chronic health condition returning to school. If your concerns are not addressed by the end of this presentation, we encourage you to email NASN using the contact information we will provide. So let's find out who's behind the voices of this presentation. Liz?
Hello, I'm Liz Clark, and I'm the Education and Practice Specialist with NASN. I am also a supplemental project director for some new funding that NASN has received from the CDC for COVID-19 priorities.
Thanks, Liz. And I'm Nicolai Bobo, Director of Nursing Education at NASN, and the project director for our CDC-funded project, which we fondly call 1601. With 1601 CDC funding, in the past 4 years, NASN has focused on the school nurse role in removing barriers to improve readiness to learn, classroom participation, and academic performance for students with chronic health conditions, identifying systems and processes that need to be in place in schools and school districts. But what about students with chronic health conditions and this new infectious disease, COVID-19? There's now a shift in focus for these same students as schools reopen to in-person learning in the midst of COVID. This shift has resulted in CDC's COVID-19 school-based guidance that will be used as the basis for the focus of this educational offering. A high-level overview of how to translate the CDC guidance to support the health and academic success of students with chronic health conditions, and a bit about school staff as they return to school post-COVID-19 closure. But please note, it's important to check the CDC website and their resources often because they are rapidly changing. So what are the learning outcomes we hope that you will be able to get? Identify 3 chronic health conditions that potentially increase the risk of a poor outcome for students and staff if co-infected with COVID-19. Describe 3 assets a school nurse brings to the school reopening team, welcoming students with chronic health conditions. And list at least 6 school protocols or considerations needed to create a safe and healthy learning environment for students and staff with a chronic health condition when reopening schools. The reference and resource slides at the end of the presentation are intended to further help support meeting these learning outcomes. So who are we talking about? Do you have students with a chronic health condition in your school? While this infographic is dated, it paints the picture that the health needs of children are more complex today than ever before. While the numbers vary depending on the source, most recently, the Health Resources and Services Administration, Maternal and Child Health, released data from the National Survey of Children's Health. This data indicated that 1 in 4 children ages 0 to 17 have a chronic health condition. Asthma accounts for 7.6%, severe allergies 18.7%, although I'll add our colleagues at Allergy and Asthma Network believe this number is way too low. And while diabetes and seizures account for less than 1% of students, we all know about the amount of care and time it takes to support the health of these students at school. There is an increasing number of acute and chronic, potentially life-threatening conditions, rare genetic disorders, transplants, such as heart, kidney, and lung, and other medically complex conditions among our student populations. Numbers may not be accurate, but trends foretell rises in the prevalence of chronic health conditions and an emerging high prevalence of multiple chronic health conditions among the pediatric population, your students. And keep in mind, there's a continuum for these chronic conditions, from the medically fragile student to those self-managing, as the opening scenarios described. So are students with chronic health conditions at higher risk for severe illness from COVID-19? There is evidence that children who are medically complex, have neurologic, genetic, or metabolic conditions, or who have congenital heart disease are at a higher risk for severe illness from COVID-19 compared to other children. There are other chronic health conditions that might place students at a higher risk for severe illness, but this evidence is evolving. Check out the website associated with the citation on this slide. Consider your population of students in your schools. How many fit these categories? We will provide some high-level resources to address management of these chronic health conditions later in the presentation, but that is not the focus of this presentation. The CDC has also identified chronic health conditions for people of any age, school staff or students, that are at a higher risk for severe illness from COVID-19. They're listed on this slide: chronic kidney disease, chronic obstructive pulmonary disease, including cystic fibrosis, being in an immunocompromised state, a weakened immune system from organ transplant or undergoing cancer treatments, obesity, having a BMI of 30 or higher, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathy, sickle cell disease, and type 2 diabetes. So while CDC has long maintained that those younger than 18 make up only 2% of cases, evolving state data paints a much less rosy picture. California and Mississippi are recording rates nearing 10%. Florida has found that 1/3 of all children tested are infected. So CDC recently updated the 2% figure reflected in this chart. The chart might be difficult to read, but focus on the top two bars that reflect children make up 6.4% of those infected. This slide from the California Department of Public Health reflects the rising prevalence of virus among children and teens from April 22nd through July 13. These two slides are examples that demonstrate how our understanding of the effect of COVID-19 on children is evolving. Studies have found that children tend not to suffer from severe COVID symptoms, but there remain unknowns: the potential long-term effect of infection, at what rate students can transmit the virus to each other while in the classroom, as well as the effect on their teachers. So if you want to check out more information about your own state, go to the link associated with the citation on the previous slide. It takes you to a COVID data tracker, a CDC site. Another health concern to keep top of mind when reopening schools is mental and behavioral health. We are all experiencing something that is new to all of us. It has been traumatic, stressful, and we have all lost our routines, social relationships, and perhaps loved ones. You may be asking, is this the new norm? Well, it's well established in the literature that there is a link between managing a chronic health condition and comorbid mental health concerns. Mental and behavioral health issues may very well be amplified when adding the layer of actual or potential COVID-19 infections. Have you considered this? Are you ready in your schools to address this? We will provide some ideas and resources on how to address this later in the presentation. So what is a key strategy to keep these students with chronic health conditions healthy, safe, and ready to learn as you welcome them back to school? Well, first and foremost, NASN is going to suggest you need to have a school nurse on the school reopening team and to lead or co-lead the COVID efforts. Do you know what guides school nursing practice? Well, this is a graphic of the framework school nurses practice under. NASN's Framework for 21st Century School Nursing Practice. It guides school nursing practice and helps school nurses articulate their role not only to themselves, but to the other stakeholders at school. The framework focuses on the student who's in the center, surrounded by the family and school and community. The framework consists of 5 principles, none higher than the other: care coordination, community public health, leadership, quality improvement, and standards of practice. The principles provide an umbrella, a category to bring like activities together. The framework provides a graphic to describe the scope of school nursing practice, which may not be known by everyone at school. A scope of practice that can be an asset for the school reopening team. The WISC model also guides school nursing practice. The framework is aligned with the whole school, whole community, whole child model that calls for a collaborative approach to learning and health. The WISC model is recognized by education professionals, A model school nurses need to be able to articulate and demonstrate how their role is an asset when implementing the health services component in particular, but also many of the other components in the model as schools reopen for in-person learning. So guided by NASN's framework and the WISC model, what exactly does the school nurse bring to your school reopening team? Well, school nurses are the eyes and ears of public health and primary care. They have a historic role in mitigating the spread of communicable diseases for all students. They are able to contribute to planning, plan implementation, and evaluating the implementation of planning, and redirecting plans to protect the health of students and school personnel during the phased reopening, while in the midst of unknown and varied trajectories of COVID. School nurses have skills in collaboration and communication among families, the school, public health, and the healthcare community. Nursing in general is held in high regard by the community, trusted for being honest and ethical. These qualities are critical to have when there are so many unanswered and evolving questions in the broader school community. School nurses can address misinformation, explain burden of disease in the community, and transmission risks. School nurses can also interpret and translate CDC and public health expert information about the evolving epidemiology of COVID-19. Because of their embedded position in the community, they understand and can address the knowledge, attitudes, and behaviors of the community. They have a firsthand view of the individual's social needs and community-wide social determinants of health. This understanding helps close the gap of potential unequal health and education outcomes as schools reopen. Evidence-based information is critical for school administration as they develop, implement, and revise implementation of school policy and approaches to safely open and keep schools open. School nurses can bring evidence-based health information to school administration. They have skills in emergency preparedness, which can be helpful immediately as well as for future planning. And finally, I want to mention school nurses are considered boundary dwellers. They understand how to navigate both the worlds of education and healthcare. This infographic can be found on NASN's COVID-19 webpage. A link is provided to this page along with other resources at the end of the slides. It is data from an NASN survey that was done in April when the pandemic was getting started, and it highlights various roles of the school nurse during COVID-19, important assets the school nurse can bring to your school reopening team, such as student outreach, assisting with deliveries to students with medication and food. Another role being the health resource expert, answering phone calls for parents and community, having virtual office hours or virtual support groups. The role in education, educating staff on COVID-19 infection control measures, teaching and providing staff with information about self-care, updating policies and plans, school health policies, as well as plans to return to school. And the role of chronic condition management. Medication and equipment returns to families is an example of that, assisting students manage their conditions and working on student health care plans. To this point, we have covered what chronic health conditions in students and staff have the potential to increase the risk of a poor outcome if co-infected with COVID-19, and what a school nurse can bring to your team as you plan for reopening schools for in-person learning, considerations you may or may not have thought of as they relate to students and staff with chronic health conditions. Now pause and think about the protocols you are putting in place for reopening schools, and think about which of the protocols listed here are missing. So next we're going to address the list of protocols from the previous slide. These are protocols or considerations to develop and implement, tailored or aligned with CDC guidelines as schools reopen. And while there are some nuances for students with chronic health conditions, these protocols or considerations relate to the health and academic success of all students. One example of a standard protocol to have in place is focused on surveillance. Surveillance protocols monitor trends. Schools need to identify indicators to describe how things are going. Maybe you are already monitoring these, but they may need to be more formalized. For example, you might be monitoring students with chronic health conditions, health office visits, disposition of students or staff after a health visit, for example, how many people were sent home, absenteeism of both students and staff, and knowledge and attitudes and behaviors of the community. Data collection protocols are also needed to be in place to track these trends. And of course, the electronic record is the gold standard for this data collection. Liz, I turn it over to you.
Thank you, Nicolene. Having screening protocols for school reentry is also important. Some schools are using an app that parents complete daily for students with 3 to 4 screening questions, including the assessment of fever, close contact with COVID-positive persons, travel in an area with a high number of positive persons, and symptoms of COVID-19. Temperature checks and system screening are a frequent part of the many reopening processes symptomatic persons to exclude them from entering buildings and business establishments. School policies regarding temperature screening and temperature checks must balance the practicality of performing these screening procedures for large numbers of students and staff with the information known about how children manifest the COVID-19 infection, the risk of transmission in schools, possible lost instruction time to the screenings, and manpower or school nurse power to accomplish the task. Schools should develop plans and policies for screening and rapid response to a student or staff member with fever who is in the school regardless of the implementation of temperature checks or symptom screening prior to entering the school building. In many cases, it will not be practical for temperature checks to be performed prior to students arriving at school. Parents should be instructed to keep their child at home if they are ill. Any student or staff member with a fever of 100.4 degrees or greater, or symptoms of possible COVID-19 virus infection should not be present in school. Schools should have a policy regarding screening and what to do if a student or school staff member becomes sick with COVID-19 symptoms. When should you refer the student or staff member to a school nurse for further assessment? The list of symptoms of COVID-19 infection has grown since the start of the pandemic and continues to evolve. The manifestations of COVID-19 infection in children, although similar, is often not the same as that for adults. It requires the critical thinking of a school nurse to do a nursing assessment and determine next steps after summarizing the assessment findings. People with COVID-19 have had a wide range of symptoms reported, ranging from no symptoms to mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure. It has been reported that children are more likely to have no symptoms or GI symptoms. This is when the critical assessment skills of a school nurse are so important. Report to the local health department cases with COVID-like symptoms. Track these cases for follow-up. Protocols for return to school after illness are also needed. Follow current federal, state, and local guidance for return after illness or discontinuation of isolation. Note, CDC's guidance is for persons with COVID-19 not in healthcare settings. First is a symptom-based strategy. There must be at least 10 days have passed since symptoms first appeared. No fever for 24 hours without the use of fever-reducing medication. And this is new as of July 17th. It was 72 hours, and CDC changed it to 24 hours. And of course, other symptoms have improved. Another option is a test-based strategy. And remember, testing, if available in your community, not all communities have equal access to testing. Testing must require the provision of 2 results of 2 negative FDA emergency use authorized tests in a row, spaced 24 hours apart. No longer has a fever without the use of fever-reducing medication, and other symptoms have improved. There's an additional time-based strategy, and this is for persons with a lab-confirmed COVID-19 positive but have had no symptoms. And this recommendation is 10 days since the diagnostic test was completed. We're also hearing in some areas that it's taking 7 to 10 days or more to get test results back. So looking at some of these other things like improvement of symptoms and no fever are very important. Be sure to check the CDC guidelines often for changes. School safety protocols as they relate to chronic health condition considerations during school reopening refers to infection control measures. It involves the basic infection control measures that have been promoted by CDC from the beginning. Healthy hygiene practices, such as frequent hand washing, covering coughs and sneezes, maintaining social distancing, wearing face coverings, cleaning and disinfecting frequently used surfaces. In the school, these infection control measures must also be tailored for the school health room. Have you thought about how you may need to make changes to the health room or the school nurse's office, physical changes, and changes in routine to care for students in general and students with chronic health conditions? Tailor these changes using CDC recommendations for schools. A different approach is needed in light of COVID-19 for healthy students. Students that come to school and report having been exposed to someone with COVID-19, such as a family member, neighbor, or friend, and students that become ill at school. We will talk about each of these in more detail in the next couple of slides. Of course, you know the school in general is implementing recommended changes to the usual routines, such as those listed on this slide. I would like to point out the last bullet, position when interacting with students. Consider a side-by-side approach versus a direct face-to-face. This will reduce your susceptibility to infection. Again, examples of how to tailor the CDC recommendations for schools as they address school health services and providing care for students with chronic health conditions. Markings to help keep children social distancing. You might consider putting tape on the floor for directions, X's on where to stand and wait. Many nurses use feet for vision screening. You can put those on the floor to say, wait here. Also look at ventilation and HEPA filters. Consult with your HVAC facility staff. You can also put a fan in your window, in your health room, if you have a window, to create a negative pressure in the room. Cleaning between each student frequently touched areas such as door handles, counters, chairs. Communication between teachers and school nurse to limit and control the number of children in the office. And what this you might think about is, do you want to have the teacher email you or call you on the phone to discuss possible concerns for a student, or use walkie-talkies? Many schools use walkie-talkies for communication within the building. Teachers also should be given resources such as first aid supplies and directions on basic first aid care, so they can address those minor injuries that occur in the classroom and outside. Do you have substitute nurses lined up? Is there a plan if the school nurse is exposed to COVID-19 and will need to quarantine at home for 14 days? Consider and develop a plan using perhaps a community agency nurse and develop a contract before school starts. A few words about identifying a space to use as an isolation room. An important new routine to establish. A room or space needs to be available in order to isolate a child or staff member who you feel is unwell. As a staff person, you can work with your building administrator to locate a separate location to establish an isolation room. If the school health office is the best location for an isolation room, then a well area needs to be established for medications and daily treatments. It can be challenging to find additional space in school settings, but this is necessary. NASN has a resource for isolation rooms, and it can be accessed on the NASN COVID resource page on the NASN webpage. Establish a system for staff to understand when to send students to the wellness office location or the isolation area for a sick assessment. For example, If a student with asthma is not feeling well and needs to use their multi-dose inhaler, the student would go to the wellness office. If a student with diabetes was feeling slightly low and needs a snack, the student would go to the wellness office. If a student with asthma was feeling sick, cheeks were flushed, breathing was labored, the student would go to the location for ill students or the isolation room. Assessments are provided in an area that is well ventilated and 6 feet away from others. It is determined that if it is determined that the student has symptoms consistent with COVID-19, then the students are recommended to wear surgical masks until families can pick them up from school for fevers and symptoms, unless they are unable to do so due to special healthcare needs or disabilities. Again, as a reminder, surfaces frequently touched by multiple people, such as door handles, desks, phones, light switches, and faucets, should be cleaned and disinfected at least daily, and I would recommend more often, as if possible, in between each student. Absentee policies for students and staff. Policies that encourage staying home if ill. There are lots of additional considerations. You also need to review 504 and IEP processes for students with chronic health conditions. Add considerations for COVID based on the student needs. Communication planning between the school, home, and medical home. You need accurate and consistent messaging. Solidify community partnerships. Think about your local public health department and others, such as a local children's hospital in your community. There's ongoing equipment and resources needed, and you should do an inventory. What are the things in the school setting you need, and what are things to think about for home? Many schools sent home technology needs for students, provided food. There may be additional things that come forward, such as families that have lost jobs and they need insurance and shelter assistance. Future preparedness, planning for another pandemic. There's a definite possibility that this is going to happen again. One of the most significant areas that school nurses will need to respond to in the return to school is mental health challenges due to the long-term pandemic, chronic stress, and a grief response endured by most of us. It is important to be aware of and address the social and emotional health of students, school staff, and yourself. Signs and symptoms to be aware of include physical signs. Look for fatigue and exhaustion, which are the most common symptoms. Other signs include difficulty paying attention, confusion, hypervigilance, headaches, stomach aches, or muscle tension may also be felt. Sleeping and eating may be altered. I know I've heard about the COVID-19, meaning how many pounds have you put on being home during this time. School nurses often see the signs in students that are experiencing stress and are very familiar with these signs. Emotional signs. Look for extreme worry or anxiety, feeling numb, angry, compassion fatigue, and discouragement. Recurrent crisis thoughts or distressing dreams. How many of you have had disturbing dreams? Sometimes confusion and having a hard time making decisions can occur. Some people may experience sadness, depression, hopelessness, and/or suicidal thoughts. Perhaps you heard about the ER doctor in New York, Dr. Lauren Breen, that completed suicide after treating many patients in New York and then contracting the coronavirus herself. It was very sad. Social signs, look for relationship issues at home or work, irritability, outbursts of anger, social withdrawal, or isolation. Poor coping behaviors such as excessive use of alcohol or other substances can also be warning signs of stress or secondary trauma. The first aspect that is important to consider is self-care. For you, students, and school staff, staff can also role model this for students and families. By maintaining a daily routine, you foster a sense of control and bring predictability to this unpredictable situation. Reduce media coverage of the pandemic. Watching media coverage for long periods of time may actually increase anxiety, keeping our response systems activated. And don't watch the news or check social media right before you go to bed. Focus on being healthy. This includes sleep, nutrition, and using stress management techniques such as taking breaks during the workday. Think of healthy behaviors such as exercise, yoga, deep breathing, calming self-talk, or soothing music. Work-life balance. Finding a balance between work and home is important. Create a gratitude journal to shift your mindset. I bet all of you can quickly think of 2 to 3 things that you're grateful for. Social connections. Appreciate those people that are important in your lives, such as coworkers, family, and friends, and let them know they are important to you. Perhaps some of you have already done this during your stay-at-home time. There are lots of mechanisms to reduce stress through spiritual or religious practices, in acts of kindness, activism, and advocacy work. Practice hobbies that require creativity. And finally, seek humor. Watch those silly videos that make you laugh out loud, or read happy fiction that takes you away and on a journey. The resources from these last 2 slides are from the National Association of School Psychologists, Coping with the COVID-19 Crisis, The Importance of Care for Caregivers, Tips for Administrators and Crisis Teams. Also from the National Association of School Psychologists, or NASP, and NASN, Helping Children Cope with Changes Resulting from COVID-19 is a resource for parents to talk with their children. It is on the NASN COVID website, and it is translated into multiple languages, so you can download that and use that in your schools. NASN also has several professional development resources on their website that school nurses can use, and they're available to NASN members and non-members. So first, I'm just going to review these quickly. The Emotional Management K-6 webinar. This webinar presents an interdisciplinary approach to managing somatization in our schools between an elementary school nurse and the school counselor. Given the attention of emotional health in children leading to academic success and the importance of attending to the whole child, this program has been developed to increase K-6 students' abilities to cope with school stress in healthy and effective ways. The participant will leave with a better understanding of the frequent visitor and tools to utilize in their health suites to assist the students they serve. Next is motivational interviewing. This engaging learning module provides an introduction to motivational interviewing strategies. The core principles and spirit of motivational interviewing will be reviewed, modeled, and practiced. The unique strengths of school nurses will be combined with motivational interviewing strategies to reduce stigma and remove barriers to behavioral health services. Walking in uncharted waters, the ACEs epidemic impacting school communities. This activity enables the learner to understand the generational impact of childhood adversity through a parent perspective and with a trauma-responsive lens. Building from the foundation of trauma-informed care to healing-centered engagement, which covers the intersection of adverse community environments and adverse childhood experiences, also known as a pair of ACEs. The learner will identify partnerships and collaborations that will assist with advocacy efforts to enhance and empower the school nurse's role in student, family, and community health, wellness, and resilience. And finally, the NASN collaborated with the National Center for School Mental Health on mental health tips for school personnel. The Mental Health Training Intervention for School Health Providers in Schools, or MHTIPS, is an innovative in-service training and implementation support system for school health providers aimed at enhancing their competence in managing the needs of students with or at risk for emotional and behavioral difficulties that interfere with learning. MHTIPS is comprised of 3 training modules. There are C&E contact hours available at no cost upon completion, and the entire MHTIPS training course is free of charge and is available on the University of Maryland website as well as the NASN website. So similar to other national organizations, NASN has been working diligently to develop resources to support students and school-based healthcare professionals in their return to school this fall. NASN has a webpage dedicated to COVID-19 resources that are open to the public. NASN recognizes that a trauma-informed response for students will be needed when students and staff return to school. NASN acknowledges that this is new territory for all of us, and it is impossible to predict exactly how schools will be starting this year. New documents released recently by NASN include a document on personal protective equipment for school nurses and considerations for students with disabilities and special healthcare needs. As promised, I want to leave you with some high-level resources for the chronic health conditions listed on this slide from the many organizations, including NASN, that are working diligently to provide resources to healthcare providers. We have included a few links along with the references at the end of the slides. At this point in time, note that students with type 1 diabetes, allergies, and epilepsy are not considered at an increased risk for a severe response to COVID-19. The research on asthma is mixed, but mild to moderate asthma does not seem to be at an increased risk. But this information is evolving. There is also, on the NASN website, chronic health condition management, part of the CDC-funded work focused on chronic health condition management in schools. A closer look at management of chronic health conditions in light of COVID-19 pandemic is being planned for the fall of 2020. So let's pause and have you reflect on what resources would you like to have to support your concerns about students with chronic health conditions and schools reopening. It's a lot to think about, isn't there? NASN released the Safer Return to School Statement on July 21st, 2020. It promotes a decision-making process for a safer return to in-person learning based on accurate public health data at the national, state, and local levels. The safety of students and staff must take priority in this decision-making. Stakeholders must feel confident about returning. It requires schools to develop and implement infectious disease readiness and emergency management procedures, and requires sufficient funding to do this, including providing personal protective equipment and hiring or retaining school nurses and other staff to coordinate health and safety procedures. Along with the other health and education leaders, there was a letter sent to the Senate leaders demanding they fund schools for a return to school plan and provide flexibility for districts and schools to prioritize their needs. NASN and the work group asked for $208 billion. Before we conclude today, we wanted to share that NASN recently released a position brief entitled Eliminate Racism to Optimize Student Health and Learning. It is the position of the National Association of School Nurses that systematic racism must be eliminated from the United States, and this elimination can begin with school systems, school staff, families, and children. Racism, a public health crisis, threatens the health, educational attainment, and well-being of children and adolescents. You're welcome to learn more about reading the entire statement, and the link is provided in the reference section at the end of these slides. In summary, what are the top 3 things you can do to prepare for students with chronic health conditions returning to school? First and foremost, plan and prepare. Collaborate with a school nurse. Next, stay plugged in. There are recommendations evolving and changing rapidly. And of course, be nimble to national, state, and local emerging changes and recommendations. For example, testing in your local community or state and technologies that may be available. And last, breathe and other self-care activities for yourself and your students. And again, there's references and resource slides at the end of this presentation. So here's our final reflection. Looking at the double rainbow that recently appeared over Lamy, New Mexico, reflect on the learning outcomes. Were they met? Are you able to identify 3 chronic health conditions that potentially increase the risk of a poor outcome for students and staff if co-infected with COVID-19? Are you able to describe 3 assets a school nurse brings to the school reopening welcoming students with chronic health conditions? Are you able to list 6 school protocols or considerations needed to create a safe and healthy learning environment for students and staff with a chronic health condition when opening schools? Are you coming away with 1 new consideration to apply in your planning to welcome students with chronic health conditions back to school? What 1 CDC recommendation for school reopening do you plan to tailor to support students with chronic health conditions, or all students, or school staff to return to school? So I'm going to pause here to allow you to reflect. Thank you so much for attending and giving us the opportunity to share some of the work NASN has been involved with to help support school nursing practice, which ultimately impacts student health and readiness to learn. If you have questions or additional resource needs that were not addressed during this presentation, please contact myself or Nicolai, and our contact information is on this slide. We do need to acknowledge that this work is being supported by a cooperative agreement with CDC,